Hi, and welcome. We're so glad you're here. At UNC Health, we want you to feel informed, comfortable, and confident as you prepare for your upcoming surgery. This video will walk you through what to expect before surgery, through your recovery, and trip home, so nothing catches you off guard. Once your surgery is scheduled, you will receive a pre-surgery questionnaire in your UNC MyChart account. Please complete it as soon as possible. Depending on your history or your surgeon's request, you may need to meet with our anesthesia team at our pre-procedure services. If a visit is needed, you'll be contacted to schedule an appointment. You may be asked to complete lab work, an EKG, or a COVID-19 test before surgery. Your doctor may ask you to pause or adjust certain medications, such as blood thinners. Be sure to follow these instructions exactly. You'll also receive clear guidelines about what to eat or drink the day before surgery, as well as how to prepare on the morning of surgery. If you start to feel sick or have new symptoms like a cough, sore throat, or flu-like illness, call us right away, especially the day before your surgery. Arrange for a trusted adult to drive you home if you are having any type of anesthesia. If no one is available to accompany you, your surgery will need to be rescheduled. Wear comfortable clothing and pack overnight items if you're staying in the hospital after surgery. You'll receive a call from pre-procedure services by around 2:30 p.m. the day before your surgery. During that call, you'll be given your arrival time and specific instructions, including when to stop eating and drinking and what you can and cannot eat or drink. If you have questions about your medications, you can ask to speak with a nurse during the call. Be sure to follow the instructions provided for showering or bathing the night before or the morning of your surgery. This helps to reduce the risk of infection. Please remove any nail polish, contact lenses, jewelry, or piercings before coming to the hospital. On the day of your surgery, arrive at NC Surgical Hospital at the UNC Hospital main campus at the time given to you during your arrival time phone call. Park in Dogwood Parking Deck and choose the middle walkway called Skywalk B from the parking deck on the second floor when crossing above Manning Drive. That walkway goes straight to the doors of the surgical hospital with the registration desk located on your left. If you are scheduled at the main UNC hospital in one of the fourth floor ORs, please go to the Women's Hospital registration desk and they will assist you in getting checked in there. After you check in, you'll be brought to the pre-operative area where you'll change into a hospital gown and begin preparations with your care team. This is where you'll meet key members of your surgical care team. A nurse will check your vital signs and place an IV. An anesthesiologist will review your medical history and go over your anesthesia plan with you. Your surgeon may stop by to review final details and answer any last-minute questions. We'll also mark your surgical site and confirm important information. Don't worry if we ask the same questions more than once. It is a standard part of our safety process to make sure everything goes smoothly. You'll start out wearing a red surgical cap, which will be changed to blue only when it's time for your surgery. This helps the team know exactly when you're ready to go into the operating room. Your loved ones will be able to stay with you until it's time for surgery, and a member of the anesthesia team will take you to the operating room. The team will help you feel at ease. You may receive medicine to help you relax before you're fully asleep. You'll be asleep for the entire procedure and carefully monitored every step of the way. When you wake up, you'll be in the recovery room. A nurse will be by your side, checking your breathing, comfort, and pain levels. You might feel a little groggy or chilly. This is completely normal. Once you're more awake and stable, you may be allowed to sip water and reunite with your support person. If you're having outpatient surgery and receiving sedation or anesthesia, you cannot drive yourself home. Someone 18 or older must come inside the facility with you, get your discharge instructions, and drive you home. Before you leave, your care team will make sure you can walk safely. Your pain is managed. You've had something to eat or drink. You understand your recovery instructions. You'll get a written guide with details about what to expect, what to watch for, and who to call if you have questions or concerns. Every recovery is different, so be gentle with yourself. Take it slow and give your body time to heal. Follow the instructions from your surgical team about when to return to work or school, when it's safe to drive, how to start back any physical activity or exercise. And if you're ever unsure about something, please call your surgeon's office. We're here to support you every step of the way. We hope this video has helped you feel informed, prepared, and supported. At UNC Health, we're committed to giving you expert care with compassion at every step. Thanks for trusting us with your care. We look forward to seeing you soon.